Good afternoon, everyone. My name is Hallie Ebbinghaus, and I am a student at SUNY Polytechnic Institute studying management and healthcare informatics. The topic I'd like to discuss with everyone today is how artificial intelligence can be integrated in electronic health records in order to detect and prevent suicide among U.S. veterans. I'd like to start our discussion today by asking a question. What does it look like to save a life? Perhaps you think of a surgeon performing a life-saving surgery, or a firefighter running fearlessly into a burning building, or a soldier defending his fellow countrymen. No matter what images surfaced for you, I'm willing to bet that when you think of all the ways saving a life can look, this, well, it's probably not the image that comes to mind. It's true, on the surface, the electronic health record doesn't exactly give heroic vibes. But for veterans in crisis, the life-saving potential of the EHR is immense. Today, we stand at the crossroads of technology and humanity, exploring how artificial intelligence can serve as a beacon of hope for our nation's heroes, our veterans. Veterans face unique and complex mental health challenges, often shaped by combat exposure and traumatic experiences. PTSD, depression, and anxiety are disproportionately high among veterans. As a result, veterans may turn to unhealthy coping mechanisms like drugs and alcohol use. Furthermore, traumatic brain injuries, which are common among combat veterans, exacerbate PTSD symptoms and have been linked to a 2.5 times higher risk of suicide death. These challenges are often compounded by difficulties transitioning back to civilian life, as well as systemic barriers to accessing care, such as poverty and homelessness, social isolation, and the stigma around asking for help. With all of these factors combined, the state of veteran mental health has become dire. Despite comprising only 8% of the US population, veterans account for 12% of all suicides in the country. Current research suggests that veterans are 1.5 times more likely to die by suicide than the general population. Perhaps most devastating of all is the fact that approximately 17 veterans die by suicide every day in the United States. These sobering statistics show that veteran suicide is more than a tragic occurrence in our communities. It is a public health pandemic. To save veteran lives, we need a health system that is proactive, not reactive. In the words of Desmond Tutu, we need to stop pulling people out of the river. Rather, we need to go upstream and find out why they're falling in. This is where artificial intelligence becomes a game changer. By leveraging the immense potential of AI, combined with the increasing connectivity and interoperability of electronic health records, we now have the ability to go upstream, transforming healthcare to not only predict, but actively prevent veteran suicides. Let's dive in to where we are at today. Thankfully, informatics experts have already begun making strides. The Veterans Health Administration has pioneered AI-driven predictive models like ReachVet, which analyze vast amounts of structured electronic medical records to identify veterans at the highest risk of suicide. These systems incorporate variables such as health service usage, mental health diagnoses, and medication patterns, achieving predictive accuracy far beyond traditional methods. ReachVet is already showing great promise. Veterans flagged by these systems are more likely to engage in mental health treatment, thereby reducing hospital admissions and suicide attempts. While structured data lays a strong foundation, unstructured data, like that found in clinical notes, holds even more untapped potential. Natural language processing, or NLP, allows healthcare professionals to extract meaning from text, audio, and even video that may be stored in electronic health records in order to make more data-driven healthcare decisions. When it comes to veteran care, NLP has given healthcare workers unprecedented insights, extracting subtle indicators of suicidal ideation that might otherwise go unnoticed. An example of how NLP has been used in veteran suicide prevention is dynamic topic modeling. Dynamic topic modeling has used clinical notes and recorded conversations from real veterans to reveal patterns in language used by veterans who died by suicide versus those who did not. Studies indicate that veterans at risk often show less variation in clinical note topics over time, signaling disengagement or deteriorating mental health. Additionally, recent advancements in ensemble transfer learning models have further enhanced our ability to identify and outreach to veterans in crisis. Ensemble transfer learning is a type of AI that uses multiple machine learning models together to interpret data more holistically than running independent algorithms. By integrating data from over 4.2 million veterans, researchers have been able to identify leading risk factors for veteran suicide attempts with 83% accuracy, a testament to AI's transformative potential. If we look at how AI has evolved over time, we can see that we are just in the early stages of incorporating artificial intelligence into our healthcare system. We are not yet at a point where we can fully rely on AI to give us the whole picture of a patient's health based on their unstructured EMR data. However, we can still take steps to leverage AI in inventive and impactful ways to improve the lives of patients across our healthcare system. AI's integration with electronic health records enhances existing suicide risk prediction models like ReachVet by analyzing both structured and unstructured data together. Artificial intelligence allows clinicians to incorporate nuanced insights into mental health treatment, enabling more comprehensive risk assessments and providing deeper insights into veterans' risk profiles. AI presents the opportunity to bring a highly individualized approach to caring for our veterans in crisis, one that is as nuanced and unique as the many men and women who serve our nation. As we harness artificial intelligence's potential, ethical considerations must remain paramount. Veterans are a vulnerable population, and their data must be managed with the highest standards of security, transparency, and fairness. Trustworthy AI ensures that systems are interpretable, empowering clinicians and veterans alike to understand decision-making processes. Importantly, AI should complement, not replace, human judgment. By acting as a supportive tool, AI can enhance clinicians' capabilities and foster a collaborative approach to veteran mental health care. The fusion of artificial intelligence and healthcare is no longer a distant possibility, but a present-day reality with the power to save lives. For veterans who have given so much for our nation, we owe nothing less than our best efforts to safeguard their well-being. And so, to my fellow students and future healthcare leaders, let us unite to scale these innovations, ensuring they reach every veteran in need. To all current and future informaticians and technology innovators who might be listening to this, let us build with empathy placing humanity at the core of every algorithm. And finally, to the men and women who proudly serve our nation today, including those heroes in my own family, living and passed on, may you remember that you matter and that we are endlessly grateful for your service to our country. As I started today's discussion with a question, I'll leave you with 3 more. In what ways can AI complement clinicians' judgment in identifying and managing suicide risk among veterans without replacing the human element in care? What lessons from artificial intelligence's application in veteran suicide prevention could be applied to address other public health crises, such as opioid addiction or chronic disease management? What emerging AI technologies or approaches could further enhance our ability to predict and prevent suicide among veterans? And what challenges might arise in implementing these innovations? As we seek the answers to these questions and others, let us advocate for a healthcare system that values prevention as much as treatment, leveraging AI to make this vision a reality. Thank you.